The broadcast is now starting. All attendees are in listen-only mode.
Well, welcome everybody to another edition of Question Lab. I am your host, Jeff Downing, and tonight we are going to take you through a set of questions related to cardiology. So, a lot of cardiovascular items in front of us tonight, and our goal is to help you get ready for exam day. Tonight, I am joined by my co-host, Sean Nanji. Sean, would you like to introduce yourself to the crowd?
Absolutely. Thank you very much, Jeff. Sean Nanji here. Been with USMLE-Rx and Rx coach for several years now, working with our talented coaches and students like you to help you on your academic journey. Asking you to bear with me tonight. I got a little bit of a cold, but hopefully I'll be clear enough for all of you to understand.
As Sean noted, we've worked with lots of students, hundreds of students, with RX Coach, helping them as they prepare for Step 1 and or Step 2 CK, not to mention just getting through med school. And what we're going to be doing tonight is we're going to be using some of the tips and techniques that we use to help prepare students for the big day. As we go through our methodology, you're going to be getting a bit of a flavor of what some of our coaching sessions are like. Okay, so with that, let's go ahead and get started. We are going to begin with question number 1. Now, if you're new here, we're glad you're here, but when we open up this first question, you're going to notice something a little bit different. You're going to notice that you don't see any answer options, and that is by design. So, what we want you to do is we want you to set up your own personal formula, your own methodology for answering questions, just so that you can, drill these drill the technique into your head so that you don't have to think about how you're going to answer questions. Because obviously on, test day, you've got, 280 questions you're going to be, cranking through for Step 1. So, what we advise you to do is cover up those answer choices. And we say that because we don't want you to, freak out if you see an option that you don't understand or you don't recognize, and anything that would kind of throw you off your game. And our second step is we want you to read the lead in, which is the question, right? So we don't want you to read the vignette first. We want you to read the question, so that you have a sense of what kind of information you should be looking for. So we start by reading the lead in. We say, okay, which of the following is a complication of this patient's most likely diagnosis? Okay, so right off the bat, you're thinking, okay, well, how many steps is this? A lot of those one-step questions are, just figuring out the diagnosis. Here, you've got to figure out a complication of the patient's diagnosis. So just getting, being able to cue into the type of data you're looking for, you can do that by reading that lead in. In rare cases, you can read that lead in and sometimes even just answer the question, right? You don't even need the vignette. That's becoming rarer and rarer, on the various USMLE exams. But again, that's why we want you to read that lead in first. Then we want you to read the vignette. And that's what we'll do right now. A 79-year-old man comes to his physician with dizziness and shortness of breath, saying that he can't swim his usual laps without feeling like he is going to lose consciousness. On examination, he has a loud, late-peaking systolic murmur at the right upper sternal border and a low-volume, slow-rising carotid pulse. So again, which of the following is a complication of this patient's most likely diagnosis? we encourage you to go down to that question box and let us know how many steps you think it will take to solve this problem. While we do that, I will turn it over to Sean.
Well, thank you very much, Jeff. So we're going to go ahead and show you what we believe are the important clues in the vignette and lead-in. So we'll go to the next slide here. And as you can see here, we've highlighted the age, right? That's important, and the symptoms. So dizziness, shortness of breath, can't swim, lose consciousness. So as you can see here, he's also got a loud, late peaking systolic murmur, right upper sternal border, and low volume, slow rising carotid pulse. So we're looking for a complication from the most likely diagnosis. We've highlighted these things for you. Some good buzzwords there, and I encourage you to take a look at what this gentleman is doing while having these symptoms. And I'll leave it at that while we move on to the next slide. So, we're looking at probably a two-step question here, right? We've got to figure out what's going on and then figure out the complication. So we're going to take a look at these answer choices. We always start at answer choice E and work our way up. We do that to make sure that nobody, accidentally prematurely selects an answer choice without looking at all of them. And if you start at E and work your way up, that'll definitely prevent you from doing that. So E, varicose veins. D, pulmonary interstitial fibrosis. C, lower extremity claudication. B, diastolic dysfunction. And A, cholesterol emboli syndrome. All right, so we're going to go ahead and open up the poll and give you some time to lock in your answers.
Yes, we are. Okay, so the poll has been launched. Go ahead and let us know which of those options you think is a complication of this patient's most likely diagnosis. This is, another one of those, board style questions where, hey, you know what, there are, potentially multiple correct answers here, but when you have to get down to it as like, figuring out what the most likely diagnosis is, right? So trying to get to that and then get to the complication requires some thinking, and of course you need to be able to think quickly. You've only got on average about a minute and a half for each of the questions, so you need to be sharp. Okay, let's see. What we typically do is we wait until about 2/3 of you have voted, and looks like almost 3/4 of you have voted. So we're going to go ahead and get ready to close the poll and take a look at the responses. Okay, so had a clear favorite. Almost half of you went with answer choice B, diastolic dysfunction, but about 1/4 of you were thinking answer choice C, lower extremity claudication, and a little split there for 3rd place. So interesting. Let's go ahead and see what the correct answer is. And the answer is answer choice B, diastolic dysfunction. Well done, everybody. Good way to start off the evening with a pretty resounding correct answer. If you didn't get it right, that's okay. Our goal is to walk you through each one of these questions so that you know how to make sure you get it right on test day. So what I'm going to do is I'm going to turn it over to Sean to help you do that. Sean?
Well, thank you very much, Jeff. Yes, great job, everyone. Whenever you see, a patient that has dizziness and shortness of breath upon exertion, you want to start thinking about aortic stenosis. Aortic stenosis is also the most common valvular heart disease in patients. So what happens here? So you get this decreased blood flow because this valve is stenotic, right? And what happens is you get decreased blood flow across the stenotic valve in the presence of, this vasodilation that occurs with exercise. So what happens is you get these symptoms of poor blood flow to your vital organs like your brain, heart, and lung, and that will cause dizziness and dyspnea. Aortic stenosis is, always known to cause a late peaking systolic murmur at the right upper sternal border. Okay, so that whenever you see that, right, that's kind of a buzzword for aortic stenosis. You'll also see what we call parvis 8 tardis, which is slow rising carotid pulse, and that's both observed in this patient, and you can also see, so you see both of those in this patient, and sometimes you can also have what we call an absent heart sound. So in this patient, we have that late peak in systolic murmur, and we have that slow rising carotid pulse, right? One other thing you can see is an absent second heart sound. So patients that have this, they'll generally have decreased exercise tolerance, dyspnea, syncope, and angina. So now what happens now we know that it's aortic stenosis. Well, we know that aortic stenosis can cause heart failure with what we call preserved ejection fraction, which is diastolic dysfunction. That happens due to compensatory left ventricular hypertrophy. So what happens is you have this hypertrophy because you have a high afterload, which is caused by that stenotic aortic valve. And that over time will eventually, have fibrosis, and over time will result in diastolic dysfunction and manifest as heart failure with preserved ejection fraction. So eventually you're going to, lead to this diastolic dysfunction that we talked about. Other complications you could have, arrhythmia, sudden death, endocarditis, but those weren't given as options here. But you all seem to nail this one right out of the park. Figured out that it was aortic stenosis. So once again, some buzzwords to keep in mind. Anytime you see some of these, exercise intolerance types of things, start thinking aortic stenosis. You see that loud, late peaking systolic murmur in the upper sternal border. Once again, you got some great buzzwords here that should give that a weight to you. So great job, everyone. Let's talk about the other answers and why they're incorrect. Varicose veins, you're going to see that that's normally age-related, and that'll happen when you have venous valve incompetence, which is not what we're seeing here. Pulmonary interstitial fibrosis, we'll see that as a result of infections, toxins, even sometimes different kinds of medications, right? Or autoimmune lung disease. But that's, again, not what we're seeing here. Lower extremity claudication. I know some of you picked that, and that can happen. I see why some of you, kind of went that route. But remember, that's going to happen due to atherosclerotic occlusion of lower extremity arteries, right? And so we're looking at a heart-related issue, and it told us about that murmur. So, that's what's going to help us rule that out. Cholesterol emboli syndrome, that'll happen usually after a procedure, like an angiography or something of that nature that'll kind of dislodge a plaque and let that embolus go elsewhere, but it's not going to lead to that type of murmur and the slow rising carotid pulse. I mean, those clues right there are textbook clues for aortic stenosis. So hopefully, we all have a better understanding of this, and let's move on now to question number 2.
Excellent. Thank you, Sean. Good breakdown there. Hopefully, everyone is all warmed up as we get ready for question number 2. We do also included a couple of shots here from first aid. Just you can go to page 300 and take a look at that. And that was actually from the 2021 edition. So look it up there on Browse First Aid in USMLE-Rx. Okay, excellent. Again, what we're going to do at the end of this session, we'll give you all the QIDs so that you can look them up and do a further study. Okay, with that, let's go to question number 2. And again, we have covered up all of the answer choices, and we're going to start with the lead-in. Which of the following best describes the mechanism of action of the new medication? Okay, so take a look at that. Think about what kind of information you're going to be looking for as we approach the vignette. A 45-year-old man comes to the office for a follow-up appointment. He has a history of hypertension, and despite treatment with hydrochlorothiazide, valsartan, and amlodipine, his blood pressure 3 weeks ago was 168/95. Today, his blood pressure is 160/90. He is prescribed a centrally acting medication for additional hypertension control and is counseled on the importance of compliance because suddenly stopping this medication can cause a severe increase in blood pressure. So again, the question, which of the following best describes the mechanism of action of the new medication? Think about how many steps you believe it will take to solve this one and put that down there in the question box. Love to hear your thoughts on that as I turn it over to Sean.
Well, thank you very much, Jeff. So we've got a little bit of a tricky question here. So let's put our thinking caps on and take a look at some of these important clues in the vignette. So we know he's 45 years old, right? Got hypertension, and he's already being treated with 3 medications: hydrochlorothiazide, valsartan, and amlodipine, right? Blood pressure 3 weeks ago was 168/95, and today it's 160/90. So they give him a centrally acting medication for additional hypertension control. Importance of compliance, because suddenly stopping this medication can cause a severe increase in blood pressure. So take a look at those clues, and those clues right there should immediately tell you what drug this is. And once we know what drug it is, like the lead-in says, we've got to figure out the mechanism of action. So let's take a look at those answer choices. Once again, we'll start at E and work our way up. E, inhibition of ACE or angiotensin converting enzyme. D, beta-1 adrenergic receptor antagonism. C, alpha-2 adrenergic receptor antagonism. B, alpha-2 adrenergic receptor agonism. And A, alpha-1 adrenergic receptor antagonism. So whenever you see a question like this, you want to figure out, you know, there's an easier way to figure this out. So one thing I'd recommend doing is figure out what you're trying to accomplish blood pressure wise and rule out all the other ones that don't fix that and narrow it down to the ones that do if you're not sure which one it is. Okay, so I'll give you that hint and we'll open up that poll and give you a few moments to lock in your answer.
Okay, excellent. Thank you, Sean. And the poll is open. Go ahead and select what you believe is the right answer. As a reminder, we're going to have a raffle at the end of tonight's session. Someone's going to get a subscription to RX 360 Plus, which includes Step 1 QMax, Express Videos, Flash Facts, and RX Bricks, turbocharged with first aid content. Okay, well, let's see here. We're got about almost 2/3 of you have voted. So if you haven't registered your vote, do it now. Looks like we've got another clear favorite amongst the crowd, but not quite as overwhelming as question number 1. So I'm going to go ahead and close that poll, and let's share the results. So again, the crowd went with answer choice B, alpha-2 adrenergic receptor agonism, whereas the alpha-1 adrenergic receptor antagonism was the second place vote getter. So again, we got a little not total consistency here, but interesting to see the breakdown. So let's go ahead and hide the results and share the answer. And the answer to question number 2 is indeed answer choice B, alpha-2 adrenergic receptor agonism. So well done, everybody. We are 2 for 2 tonight, which is fantastic. If you didn't get it, that's okay. Sean's here to help you walk through it. Sean?
Well, thank you, Jeff. Definitely a challenging question here. So, you know, oftentimes students will miss this question because they forget what these receptors do, what happens when you agonize them, and what happens when you block them. So let's start off with the pattern. I've repeated on Question Lab many times. So you've got alpha 1, beta 1. So we'll look at those as 1-lane roads, and we'll look at alpha 2 and beta 2 as 2-lane roads, right? So the 1-lane road has less room, right? So that's how we know that alpha 1, beta 1, 1-lane roads, less room, cause vasoconstriction and increase your blood pressure. And alpha 2, beta 2, these are your 2-lane roads that have more room. And by stimulating those, you'll cause vasodilation and decrease your blood pressure. So that's what happens when you agonize it, right? So that's our norm, right? When you agonize it. So when you block it, the exact opposite will happen, okay? So now what we're trying to do is deal with hypertension. So what we want to do is accomplish vasodilation. We have to figure out which drug it is and what the mechanism is. So the answer here is alpha 2 receptor agonism, as 38% of you said, and the drug we're talking about here is clonidine, which is an alpha 2 receptor agonist. It is the only centrally acting antihypertensive medication, and we only use this generally, okay, when it's either a hypertensive urgency or when you're giving people a medication because their hypertension is not controlled with other agents, which is what's happening here. So we're adding an extra medication because the ones that we're giving aren't enough to manage the patient's condition. So, you know, it fits our pattern, alpha 2, 2-lane roads. If you agonize it, you got vasodilation, right? So once you activate that alpha 2 receptor, you will decrease sympathetic outflow in the central nervous system, which will decrease your peripheral resistance, your heart rate, and your blood pressure. Now, the reason why another clue here is important is if you go back to that vignette, it tells you that if you suddenly stop this medication, you can cause a severe increase in blood pressure. And that's because you have this rebound hypertension as a result of the sudden increase in sympathetic outflow. So once you stop that medication, abruptly, you're going to have rebound hypertension. It's a very, very important buzzword for that drug clonidine. So, you know, that's why the answer choice is B, and that's why B is correct. So why are the other answer choices wrong? E, you know, if you look at every other medication here, right, other than the alpha 2 antagonist, right, all the other medications are going to help with hypertension. But the difference between all of those and clonidine is that clonidine is the only one that is centrally active. It's the only one that's centrally active. So if you didn't know that medication, you would have narrowed it down to 4 choices and then just had to take your best guess, okay? You should have already and immediately ruled out alpha 2 receptor antagonism. And generally speaking, when you see 2 answer choices like that are the exact opposite of each other, you're probably looking at one of those that's going to be the correct answer, okay? So you have to figure out which one it is. So let's say you're confused and you don't know what's going on with this question. If you look at these answer choices, you see 2 answer choices that are directly opposites of each other, right? And if you don't know what's going on, try to rule one of them out and pick the other one. And if you had done that here, you would have still gotten it right, okay? It doesn't work every time, but if you're in a bind, try using that little test taking technique. So, you know, that's why the other answer choices are wrong. You know, hopefully that was a good enough explanation for you. It's pretty straightforward. Sometimes it boils down to knowing those buzzwords and knowing the medications. You know, we didn't talk about the alpha 2 antagonist, and that's because that would actually increase blood pressure, like I said. All of the other ones, once again, are not centrally acting. So good job, everyone. Let's move on to the next question.
Excellent. Thank you, Sean. Before we do that, I want to just note that, you know, a lot of you that are here tonight, some of you may be in dedicated or getting ready for dedicated. Some of you may be thinking about taking step 1 later in the summer, or maybe later this fall, or even next year. And, you know, at RX Coach, you know, we launched this program a number of years ago to help students prepare for the big day. You know, we've got a team of certified tutors that work one-on-one with students to help them achieve their goals. And what we do is we start out by getting to know you, and as a part of that getting to know you process, we have our free consult, and if you find that this is something that you you like our approach and you see the benefits, we start with then a 160 question assessment. So all of our coaches have a good understanding of where your strengths and weaknesses are, right? So we want to make sure that our plan is attuned to your needs. So we start with that assessment, and then we set up a personalized study plan. Now we do, this is one-on-one coaching, right? This is not a group setting. This is not like a Zoom class. You're going to be working one-on-one with a tutor who's already been through this, right, and has all of the mentoring skills needed to help you, do your best on test day, and help you achieve your dreams. So, what we want to do is just note we've got the link there. We invite you to take a look at RX Coach. And like I said, if you're interested in learning more, you can set up that free consult, and we will help answer your questions to make sure that that it's the right fit for you. We've helped hundreds of students, help get them to the next stage of their their lives as future physicians, and helping them try to get that dream residency, right? That's what our goal is. So again, RX Coach, that's www.rx-coach.com. Go ahead and you can go in there and quickly set up that free consult. Okay, we've got we're halfway through tonight. We've got 2 questions left, and we do have a raffle at the end of the evening. You do need to be present in order to win, so make sure you stick around. Let's go ahead and go with answer or question number 3. Again, we've got all of the answer choices covered up for you, and we're going to begin with the lead-in. Norepinephrine administration in this patient would be expected to produce which of the following physiological responses? Okay, so again, kind of an unorthodox question, at least in terms of the way that it's worded, right? This is, you're going to have to be kind of thinking through what kind of data am I going to be looking for from the vignette. So with that in mind, now that you're cued in, let's read that vignette. A 62-year-old man admitted for bacterial pneumonia is intubated for airway protection due to altered mental status. Temperature is 38.8, pulse is 133, and blood pressure is 82/40. He has a tidal volume of 450 milliliters and a fraction of inspired oxygen of 40%. Lung fields are cleared auscultation, and there is a 2/6 apical systolic murmur. Blood pressure is not improved after 3 liters of normal saline. Intravenous administration of norepinephrine is started. So, the question again, norepinephrine administration in this patient would be expected to produce which of the following physiological responses? Now, think about that. Think how many steps it will take to solve this one as I turn it over to Sean.
Well, thank you very much, Jeff. Once again, we'll show you what's important here, in our opinion. Got the age 62 years old, bacterial pneumonia, intubated, altered mental status, got a fever, pulse is 133, blood pressure 82/40. Look at that tidal volume of 450, and look at that fraction of inspired oxygen to 40. Lung fields are clear, but there is a 2/6 apical murmur. It's systolic. Blood pressure is not improved after 3 liters of saline, so they give norepi. So now, that being said, what's the real question here? The question is, what's norepi going to produce in terms of a physiological response? So you need to know what norepi does, what its mechanism of action is, right? So let's take a look at those answer choices. Starting from E and working our way up. E, decreased systemic vascular resistance. D, decrease in pupillary dilator tone. C, decrease in platelet aggregation. B, decrease in heart rate. And A, decrease in diastolic filling pressure of the heart. So once again, we're going to open up the poll and give you a few moments here to lock in your answers.
Okay, very good. So the poll is launched. As Sean said, hey, patient's gotten norepinephrine. What's going to happen? Pretty straightforward, but you have to obviously be thinking about all of the different variables regarding, how that patient got there and what's going on with that patient. So let us know what you're thinking. Lock in that answer. If you go to our chat, we've got we put in some helpful links in there for you. We do record all of our question labs, and we put them up on our YouTube channel. Sometimes they're also put up on Facebook, but Facebook is not necessarily as reliable. So you can always find it on YouTube. It may show up on Facebook. I'll share some information about another webinar here in just a minute. Let's see. So we've got about 3/4 of you have voted. So let's go ahead and get ready to close the poll. And once we do that, we'll share the results. Okay. So, this one, much tighter, right? Neck and neck battle between answer choices A and B. Little over a third of you think that norepinephrine is going to produce a decrease in diastolic filling pressure of the heart. Just under a third of you think it's going to result in a decrease in heart rate. Got double-digit responses for answer choices D and E as well. So let's see what the answer is. I'm going to hide the results and reveal the answer. And the answer to question 3 is answer choice B, decrease in heart rate. So it was close, but we can't take the win for that one since answer choice A did get a few more votes. But overall, another tough question. But still, hats off to the crowd here. If you didn't get it right, that's okay. This is the time to get it wrong. What we want to do is make sure that you get it right on test day. And to ensure that that happens, Sean is here to walk you through the answer. Sean?
Well, thank you very much, Jeff. Definitely another challenging question. And this is actually one that you want to, familiarize yourself with, because it is going to be something that not only comes up on your board exam, but also in practice. And you want to know why you're giving norepi in these situations. So let's talk about it. So we know this patient has, acute respiratory failure, right? He's got a fever, he's got altered mental status, tachycardia, and hypotension. And we already knew that they had bacterial pneumonia. So we're thinking here, this patient likely has septic shock. So what happens in septic shock is that bacteria will release these toxins and antigens, and that's going to provoke this systemic inflammatory response. And as a result, you're going to have significant vasodilation systemically, which is why that blood pressure is as low as it is, right? So when you have this vasodilation, you're going to have hypotension along with baroreceptor mediated tachycardia, which is why if you see here, the pulse is high and the blood pressure is low. And anytime you see that after an infection, you want to start thinking about septic shock. Pulse high, blood pressure low, okay? So now what we have to do is we have to provide, hemodynamic support to make sure that we have enough perfusion to these tissues, because if not, we're going to end up with multi-organ failure. Okay, so how do we do that? Well, the first step is fluid resuscitation. And as you can see here, they were given 3 liters of normal saline, and that didn't work, so it was insufficient. So if that doesn't work, then we have to give vasopressors. And we do that because that's going to increase systemic resistance, or we can give drugs that will increase cardiac contractility. But the first line treatment for hypovolemic and septic shock is norepinephrine. So what happens when you administer norepi? It's going to result in increased venous return to the heart because of that vasoconstriction in conjunction with increasing your contractility, which was going to give you that increased stroke volume, okay? So as a result, you're going to have an increase in your MAP, or your mean arterial pressure, because you have this vasoconstriction. And as a result, you're going to have reflex bradycardia, or reflex decrease in heart rate, which is an effect of norepi. So keep in mind that norepi can result, and should be expected to result, in an increase in both systolic and diastolic blood pressure, and is known to cause decreased heart rate, what we call here reflex bradycardia. Okay, so that's why we're giving the medication. That's the mechanism behind it, and why answer choice B is correct. Okay, so hopefully you have a better understanding of how to treat situations like this in real life and answer these questions correctly on board exams. Let's talk about why some of the other answer choices are incorrect. Decrease in systemic vascular resistance. Well, norepi at the alpha-1 receptor is going to lead to vasoconstriction, okay, which is going to cause an increase rather than a decrease in systemic vascular resistance. You don't want to cause a decrease in resistance, right? Because you've already got low blood pressure here. So that would be counterproductive to our goals. Answer choice D here. We've got decrease in pupillary dilator tone. We're not going to have that here, right? Because if you have a patient, right, on norepi, you're going to increase that systemic vascular resistance rather than decrease it, right? You're going to have also that venous return to the heart increase rather than decrease. And what will happen is you're going to have an increase in that pupillary dilator tone, which will cause contraction of the muscle, okay? So that's just something that norepi is known to do here, and that's not what it is. It's the exact opposite of what it does. Decrease in platelet aggregation. Once again, the opposite. The effects of norepi at the alpha-2 receptor will actually cause an increase in platelet aggregation. That's why B is correct. We also talked about A when we talked about why B was correct. You're not going to have that decreased feeling here. You're gonna have an increase in it. So once again, you need to know the mechanism of norepi in order to get this right, but you also want to understand why you're giving it in this situation, because this is a great question that can be asked several different ways to really, test your understanding of how to manage a patient. And this question, there's variations of this question that come up in step 2 also. So for those of you who got it right, great job. It is definitely a challenging one. For those of you who didn't, we completely get it. It was definitely challenging, but hopefully you're more equipped to answer it correctly going forward. Let's move on to our last question now.
Excellent. Thank you, Sean. Yeah, so we've got, we'll share the QIDs here at the end of the evening. And when you go into USMLE-Rx, you'll be able to dig into more of these physiological variables. Okay, so now it is time for the lightning round. Question 4, our final question of the evening. Let's go and see what we've got. So here, again, we've got all of those answer choices somewhat covered up, but you'll see here that the all of those labels there on the image are going to play a role. So we start by reading the lead-in. Which point on the tracing best corresponds to the patient's third heart sound. Okay, so we know that we're going to need to recall everything that's important about heart sounds, and we're going to need to take a look at that jugular venous pressure diagram. So with that, let's go ahead and read the vignette. A 60-year-old man with a history of systolic heart failure is brought to the emergency department because of shortness of breath. Auscultation of the chest discloses diffuse pulmonary crackles and an S3 heart sound. His jugular venous tracing is shown. Which point on the tracing best corresponds to the patient's third heart sound? Okay, take a look at that. Head down to the question box. Let us know how many steps you think it's going to take to solve this one as I turn it over to Sean.
Well, thank you very much, Jeff. Once again, highlighted what we believe are important here. You got a 60-year-old man, systolic heart failure, shortness of breath, diffuse crackles, S3 sound, and you got the jugular venous tracing here. And we got to figure out what corresponds to the patient's third heart sound. So what's going on in that third heart sound? What's causing that heart sound? And then where do we see it on the diagram? That's how you can figure this one out. So let's go ahead and take a look at those answer choices. As you can tell, it's just going to be A through E, right? So let's go to the next slide here. We'll leave the diagram up for you and open up the poll here in just a minute so you can lock in your answers.
Yep, so again, take a look at the jugular venous pressure diagram here at the bottom. You can see the labels A, B, C, D, and E. Look at where they are according to the tracing. And now when I launch the poll, you're not going to see the image anymore. So just at this point, you should already know what your answer is. So let's go ahead and launch this one. Like I said, it's the lightning round. Goes fast. Go ahead and let us know which one best corresponds to the patient's third heart sound. I do want to note we do have another webinar tomorrow night. Dr. Tao Lee, the senior editor for First Aid for the USMLE Step 1, he is going to be leading a session of the path to USMLE success, basically the short version of First Aid. So if you've got questions about Step 1 or just looking for deeper insight, make sure you sign up there. So I've got the link in the chat. Okay, let's close the poll here. I think this is a tricky one. The votes were pretty slow to come in, and that indicates that either you need a little bit more time looking at the tracing, or you weren't quite sure. So let's close the poll and share the results. So again, kind of looking at the jugular venous pressure points, you can see that most of you went with or the highest vote getter went with answer choice D there, with answer choice E and C coming in second and third place respectively. Okay, let's go ahead and hide the results and reveal the answer. And the answer choice is answer choice E. So tricky one. I think there was something about this one that was that tripped some folks up, Sean. So let us know how we should approach this one.
So this is definitely a challenging question. It's going to test your physio, and that's cardiac physio tends to be generally a difficult topic for all students. So don't feel bad. If you didn't get this question right, we're going to walk you through it here as best we can. So, what is that third heart sound? So the third heart sound is an abnormal sound, right? And that's generally found in patients that have systolic heart failure. It happens just after the mitral valve opens and the left atrium empties when blood is rushing into the ventricle, okay? So blood hitting this compliant left ventricle, right? And that's what happens in dilated cardiomyopathy or CHF, is going to create that sound. So now you see here the JVP and how it corresponds to the overall cardiac cycle. So if you look at the tracing, it gives an approximate measure of right atrial pressure tracing, and you kind of get an idea of it. So if you look here, the jugular venous tracing, you have this thing called the Y descent, okay? And that's going to represent the rapid emptying of the right atrium after the tricuspid valve opens, okay? And that's going to be that S3, that S3 heart sound. So if you want to go back, kind of review it, right? So you have this point E, and that's what's going to correlate best. And that's because, once again, that's the rapid emptying of the right atrium following the opening of the tricuspid valve. Now, the third heart sound, that's an abnormal sound found in people with systolic heart failure. So if you remember that, and you look at that Y descent, that's the right atrium emptying into the right ventricle. That's what's going to correlate best to that sound. So the way I, approach this with students and in general is you're going to get these diagrams on your exam no matter what. So the first thing you have to do is make sure you've mastered both the cardiac cycle diagrams, and then move on to the diagrams and the charts in first aid, which list out and kind of show you what happens with different heart sounds and how they correspond to graphs physiologically. And in order to get those right, like you see here, you need to understand the cycle, and you need to understand what's happening with each sound, what's opening, what's closing, what's going up, what's going down. And if you know that, you'll be able to get it right here. And as you can see on this diagram, there you go with S3, and you see that Y right above it, and it kind of correlates above and below here with that JVP. So you look at that purple line there, and it kind of corresponds with that blue line there of S3. So, a lot of people are, they kind of try to memorize this. If you memorize this, you're likely going to miss the question, right? What you want to be able to do is explain this out loud, like you're teaching it to somebody or to yourself. And once you can talk through this and explain it to somebody else, you'll know that you've got it. You've mastered the material as well. So definitely some challenging questions tonight. Hopefully, we all learned a little bit more from this and are ready to tackle these cardio questions.
Well, this is a great way to close the evening, especially when you're dealing with cardio. This is stuff you've got to know. You got to understand those heart sounds. You got to understand, each stage of the cycle. So, great work, everybody. You guys hung in there the entire night, and glad that you were able to hopefully pick up some good tips from tonight's session. Now, as I noted, we are pulling all of our questions from the RX QMAX question bank. So go ahead and screenshot this, or write down these QIDs. So when you get into USMLE-Rx, you can go ahead and type this QIDs into search. So if you've got RX 360 Plus, or if you've got Step 1 QMAX, you'll be able to pull up all of the questions and the answers and all of the explanations, as well as all of the related bricks and flash facts and express videos and those pages in first aid that we were referring to.